Hemoglobin is a molecule in red blood cells which is important for the transport of oxygen. Anemia is a condition where the hemoglobin level is below normal. There are many causes of anemia, and today we shall examine one of the causes of anemia, that is, iron deficiency. World Iron Deficiency Day falls on the 26th of November. This video is to help raise awareness of this very common disorder which has a significant negative impact on health and well-being. There may be no symptoms when iron deficiency is mild. Iron deficiency anemia develops when body stores of iron drop too low to support normal red blood cell production. Typical symptoms include tiredness and lack of energy, shortness of breath, noticeable heartbeats, and a pale appearance. Patients may also experience headaches, body aches, and tinnitus, which is a buzzing sound in the ears. Less common symptoms include hair loss, an unusual craving for non-food items such as paper, soil or ice, difficulty in swallowing, and restless legs. Physical signs in iron deficiency anemia include pallor and a smooth tongue. The nails may be flat, or even spoon-shaped, in long-standing iron deficiency anemia. Iron deficiency anemia can result from poor nutrition, especially in those whose diet lacks meat and leafy green vegetables. It can happen due to poor absorption of iron, for instance in those who have undergone bariatric surgery. Increased demands for iron in growing children, pregnancy and breastfeeding may also result in iron deficiency. More commonly these days, we see iron deficiency anemia as a result of chronic, or long-standing, blood loss. Typical causes include heavy menses in women. Chronic loss of blood from the gastrointestinal tract may occur from stomach ulcers, piles, and also cancer of the stomach or colon. To diagnose iron deficiency anemia, a blood test called a full blood count is done. Anemia is indicated by a low hemoglobin level. The MCV, or mean cell volume, is typically low, which indicates that red blood cells are smaller than normal. The platelet count is sometimes high, a feature known as reactive thrombocytosis, which by itself is harmless. The blood film examination under the microscope is typically reported as red blood cells being hypochromic microcytic, which means the cells are pale and small. Do note a very similar blood picture can be seen in those with thalassemia, which is an inherited blood disorder fairly common in Malaysia. Therefore, the diagnosis of iron deficiency should be confirmed instead of relying only on the full blood count. The confirmatory test is a serum ferritin level. Ferritin is the storage form of iron and will be typically low in iron deficiency. Falsely normal or even high ferritin can occur as a result of infection, inflammation, or liver disease. An alternative test for iron deficiency is the transferrin saturation, which is also low. Treatment of iron deficiency anemia is by administration of oral iron. Iron tablets can sometimes cause a bloated feeling, in which case one could take the tablets with meals instead of on an empty stomach. Vitamin C can increase the absorption of iron. On the other hand, antacids, which are taken for heartburn, can interfere with the absorption of iron and should not be taken at the same time as iron tablets. Iron tablets can also cause constipation, and this can be reduced by taking fruits regularly. The stool can also be dark as a result of iron ingestion. For patients who cannot tolerate oral iron, intravenous iron can be given. Blood transfusion is generally not indicated for iron deficiency anemia, and is reserved only for those with very low levels of hemoglobin and are very symptomatic, or if there are coexisting medical conditions like ischemic heart disease which requires faster correction of the anemia. It is important to determine and treat the underlying cause of iron deficiency anemia. For women with heavy menstruation, a review by a gynecologist is usually carried out in case it is due to conditions like fibroids or endometriosis. Your doctor may recommend an endoscopic examination of the gastrointestinal tract to look for sources of bleeding like gastric ulcer and colon cancer. In children, intestinal worm infestation may be a cause, in which case deworming medication is indicated. Thank you very much for watching. We hope the information presented has been useful to you, and that we have created awareness on this simple, yet debilitating condition which often goes unrecognized. Do feel free to share this video with others.